In this video, we're going to be trekking out to the Wild West to explore a visual mnemonic for Wegener's granulomatosis, otherwise known as granulomatosis with polyangiitis, abbreviated GPA for short. Wegener's granulomatosis is another type of small vessel vasculitis, or inflammation of the arterioles and venules. It can cause troubling conditions such as hematuria, hemoptysis, and pauciimmune crescentic glomerulonephritis. So what are we waiting for? Let's get started. First, notice this old wagon here. This scene takes place in the 1800s, and back when there were no cars or airplanes around, people mainly used to get around via, that's right, wagons. Pretty old school, I know, but this old wagon here is to help you remember Wegener's granulomatosis, which is also known by the name granulomatosis with polyangiitis. Wagon for Wegener's. Got it? Next, notice our old grannies in this wagon. As homesteaders, they're making their way out to the west to farm their own land. These grannies are here to help anchor the word granulomatosis, which refers to the presence of necrotizing granulomas on biopsy. Granny for granulomatosis. Get it? These granulomas look something like this on histological appearance. Also notice what our grannies are knitting. A bunch of red yarn. The bunches of red yarn kind of make me think of blood vessels, or polyangiitis. Poly because there's a bunch of yarn, and angiitis because the yarn is, well, red or inflamed. Now you know Wegener's other name, granulomatosis with polyangiitis. Just remember our grannies knitting here, and you'll remember that this vasculitis has both granulomatosis and polyangiitis. Next, take a look at this puddle of water here. It's raining quite a bit, and it looks like our homesteaders are having a hard time making the trek out to the old Wild West. This puddle of water is here to help you remember that Wegener's granulomatosis is a type of small vessel, or small puddle, vasculitis. At Pixorize, this recurring image of a small puddle symbolizes small vessel vasculitis. If you can recall from our video on microscopic polyangiitis, small vessel vasculitis refers to small vessel inflammation, which is what is responsible for the signs and symptoms seen in Wegener's granulomatosis. Next, notice these water droplets spraying our homesteaders. These small water droplets are here to help you remember the finding of palpable purpura. Yeah, involvement of small vessels near the surface of the skin leads to palpable purpura. Now, what are palpable purpura, you ask? Well, palpable purpura are visible, non-blanching hemorrhages that occur in the skin. They look a bit like, well, water droplets. That is, if water droplets were purple. These purpura are also palpable because they can actually be felt by palpating the affected area. They look kind of like this. Palpable purpura is seen in nearly every small vessel vasculitis, and it happens because involvement of small blood vessels under the surface of the skin. Inflammation of these small vessels causes leakage of blood, so the purple color and raised appearance is really just blood clotting under the skin. Now that we've discussed that Wegener's granulomatosis is a small vessel vasculitis, let's briefly bring our attention back to the sickle-shaped scythe that's attached to the wagon. What? You would go out west without a sickle? Please. Anyway, this crescent here should help you remember that Wegener's granulomatosis causes crescentic glomerulonephritis, otherwise known as rapidly progressive glomerulonephritis. The crescentic in crescentic glomerulonephritis refers to characteristic glomerular crescents, which can be seen on renal biopsy. The crescents themselves are really crescent-shaped scars, which are, of course, indicative of glomerular damage. Take a look at this picture to see what we're talking about. And what's that right next to this crescent-shaped scythe? It's a lamp. But oh no, it looks like the lamp got broken on our journey. Yeah. Riding in a wagon is really bumpy. I'm not at all surprised the lamp broke. Since the lamp is broken, you might even say that there's a lack, or paucity, of light here, or really a lack of fluorescence. The lack of fluorescence here should help you remember that a pauciimmune pattern for Wegener's granulomatosis is seen on immunofluorescence. Pauciimmune means that there is no immunofluorescence, as in none of the cells light up. Yep. This wagon light is definitely not lighting up anything. So why does this pauciimmune stuff even matter in the first place? Well, crescentic glomerulonephritis is not unique to Wegener's granulomatosis and actually has a variety of causes. To narrow down the differential diagnosis, we need to run immunofluorescence on the biopsy slide. In this test, immunofluorescent probes are attached to antibodies specific for IgG. Since IgG is a type of antibody, the presence of immunofluorescence indicates the presence of hypersensitivity. While other patterns exist, one characteristic of Wegener's granulomatosis is a completely negative pattern, also known as a pauci-immune pattern. The word pauci means few, so a pauci-immune pattern refers to a lack of bound immunoglobulins, or autoantibodies, that are deposited immune complexes. To summarize what we've just talked about, this lamp that has no light in it is here to remind you that there is no immunofluorescence on biopsy for Wegener's granulomatosis. This lack of immunofluorescence is indicative of minimal hypersensitivity. The glomeruli are being damaged, but the damaged glomeruli have no IgG. The glomeruli are therefore being damaged in some other manner. Now that we know that Wegener's granulomatosis causes pauci-immune crescentic glomerulonephritis, let's briefly discuss one of the telltale signs of kidney damage. Take a look at this red yarn that our grannies are using for their knitting. This red yarn is located near one of the granny's lap and trails down to the floor. Pretty awkward, we know, but this red yarn here should remind you of hematuria, or blood in the urine. But the kidneys aren't the only organs involved in Wegener's granulomatosis. Take a look at this child over here. He's coughing up blood into his handkerchief. If any of you out there ever played the game Oregon Trail, you would remember that the kids always got sick on the wagon. Anyways, the blood on this child's handkerchief should help you remember that Wegener's granulomatosis causes hemoptysis, or coughing up of blood from the lungs. Hemoptysis is really important to remember because it suggests involvement of the lower respiratory tract. And that's exactly what's going on here. The small vessels of the lower respiratory tract are inflamed, which can cause leakage of blood into the alveoli and coughing up of blood. Just remember that if a condition causes hemoptysis, it most likely involves the lower respiratory tract. Next, take a look at this poor young woman over here. She's blowing her nose into her handkerchief. It looks like she's been crying because her family member is sick. This woman blowing her nose is here to help you remember that Wegener's granulomatosis causes upper respiratory tract inflammation. I want to reiterate this because it's important. Wegener's is associated with upper respiratory tract inflammation. Examples include chronic nasal mucosal inflammation, which can lead to crusting around the nose, nosebleeds, runny nose, and even nasal ulcers. The fact that our wagon has stopped here is no accident. Notice that our sick child is standing in front of this ancient tribal shrine. It's been said that this tribal totem has magical healing powers. That must be why our travelers have stopped here. It's the only way to save their sick kid. Now I want you to focus on the statue's big ears. Yeah, those are some huge ears. And no, these big ears aren't meant to signify better listening skills, but they're meant to help you remember that Wegener's granulomatosis can cause otitis media, or inflammation of the middle ear. You know, big ears for ear involvement? You should know that the middle ear canal is connected to the upper respiratory tract and sinuses, so it should follow that the middle ear might also be affected in this disease. Next, notice our statue's nose. There's some sort of decorative piece piercing right through the middle. Maybe it's some sort of style icon from ancient times. Anyways, this piercing perforating right through the middle of the nose helps you remember that a perforated nasal septum is a potential complication of Wegener's granulomatosis. You see, chronic inflammation leads to remodeling of tissue and formation of fistulas, right? Well, in this case, remodeling and connection of between the nasal cavities manifests as a perforated nasal septum. Should make sense, right? Okay, let's shift our attention to the strawberry bushes right beside our shrine here. Why is it that magical shrines always come with lush wildlife? Wow, this shrine is really an oasis out here on the trail. Anyway, what do you think those strawberry bushes represent? Well, these strawberries are a symbol for strawberry gums, or gums with a red, friable appearance. Oral mucosal involvement of Wegener's granulomatosis causes strawberry gums. This is basically the result of small vessels in your tongue getting inflamed. Next, notice this pear tree hanging over our strawberry bushes. This pear tree is here to help you remember that Wegener's granulomatosis is positive for PR3 ANCA. Get it? A pear tree for PR3, pear for PR, and 3 for tree, right? In Wegener's, PR3 ANCA is present, with PR3 referring to antiproteinase 3. Now, why is this important? Remember how we just talked about how a posse-immune pattern helps narrow down the differential diagnosis? Well, it turns out that there are a few systemic vasculitides that have a negative or posse-immune immunofluorescence pattern. So in order to distinguish between these, we can order tests for anti-neutrophil cytoplasmic antibodies, also known as ANCAs. In Wegener's, ANCA antibodies against PR3 or proteinase 3 are present. On a related note, notice this giant bobcat just lounging around in the pear tree. Actually, the tree is obscuring most of this cat, so all we can see is the cat's ankle. This cat's ankle is here to symbolize PR3 ANCA's other name, C ANCA. C ANCA for cat ankle, get it? The C in C ANCA actually stands for cytoplasmic. And this basically is here to say that proteinase 3 is a cytoplasmic protein. That is, when you test for these anti-neutrophilic antibodies, you'll see the cytoplasm of neutrophils light up. In any case, PR3 or C ANCA is fairly sensitive and specific for Wegener's, so a positive C ANCA test on exam day should definitely point you towards this disease. Now, let's talk a little bit about treatment. What's that eating the strawberries off of this bush? Yep, you guessed it. It's a cyclops fox, or fox with one eye. This cyclops fox didn't just come out of nowhere, but we'll get back to this shortly. Our cyclops fox is a symbol for cyclophosphamide. Cyclops fox for cyclophosphamide. Get it? Similarly, notice this burning asteroid on the ground here in front of our shrine. This explains why the shrine was built here. It must be the source of the shrine's magical powers. But too much radiation maybe isn't a good thing. In fact, the radiation from this asteroid is also what caused our fox to mutate into a cyclops fox. Kind of crazy how that works, but that's besides the point. Asteroids are a recurring symbol for corticosteroids because asteroid rhymes with corticosteroid. This asteroid is here to help you remember that corticosteroids are an alternative treatment for Wegener's granulomatosis. Man, that was a lot of material to cover in one video. I'm wiped, and so are our homesteaders. Let's do a quick recap. Wegener's granulomatosis is a small vessel vasculitis that affects the lungs, kidneys, ears, and nose. Involvement of the lungs can lead to hemoptysis, and involvement of the kidney leads to hematuria. On renal biopsy, a rapidly progressive or crescentic glomerulonephritis is seen, and immunofluorescence reveals a posse-immune or negative pattern. Wegener's granulomatosis can also lead to chronic nasal and sinus mucosal inflammation, which can lead to a perforated nasal septum and ear involvement. Importantly, patients with Wegener's granulomatosis will often test positive for PR3 ANCA and C ANCA. Treatments for Wegener's, like many other vasculitides, include cyclophosphamide and corticosteroids. While that wraps up this video on Wegener's granulomatosis, I really do hope that these homesteaders find their way out to the Wild West. See you for our next video.